Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. And if you didn't already know, Bambu Care is home to the Treehouse, which is an all-in-one dementia care resource and education platform for dementia caregivers. So if you're interested in learning more about how our platform can help support you on your dementia care journey, you can check it out at letsbamboo.com/treehouse, okay? So, the month of October is Lewy Body Dementia Awareness Month, and though we've already done a podcast episode on Lewy Body Dementia, which I'll link in the podcast notes, I wanted to talk more specifically about Parkinson's disease dementia, which is a type of Lewy Body Dementia. So, Lewy Body Dementia encompasses two main types of dementia with Lewy bodies and Parkinson's disease dementia, okay? Now, as I always say, with any kind of dementia, there is something going on that is causing the symptoms of dementia, which most often looks like changes in thinking skills, but can also include memory loss. And it's significant enough to impact daily functioning. That's really important to understand. So with Parkinson's disease dementia, there are these abnormal microscopic deposits composed primarily of alpha-synuclein. These deposits are called Lewy bodies and is considered an abnormal protein. The same holds true for dementia with Lewy bodies, okay? So there's nothing really distinguishing here. So how do we distinguish Parkinson's disease dementia from dementia with Lewy bodies? So Parkinson's disease dementia starts with Parkinson's disease. And with Parkinson's, the brain change that occurs begins in the substantia nigra, which is an area that plays a key role in movement through the production of dopamine. This is why the early symptoms of Parkinson's typically involves tremors or shakiness, slowness of movement, muscle stiffness, a shuffling gait or impaired balance and coordination, as well as a stooped posture, and also what's known as a masked face, which is caused by stiffness of the facial muscles, which makes it really hard to express feelings on the face. Now, Parkinson's disease is neurodegenerative, so as the condition progresses, it can affect other regions of the brain, such as the frontal lobes, the limbic system, and hypothalamus, and so on, okay? So about 50 to 80% of people with Parkinson's will eventually experience dementia. People tend to be at a greater risk of Parkinson's disease dementia if they were diagnosed with Parkinson's later in life, or if they've been living with the condition for many years. On average, it can take about 10 to 15 years after initial motor symptoms start for a person to experience dementia symptoms, but of course, the timeline can vary. In fact, if a person begins to experience dementia symptoms at least 1 year after they were originally diagnosed with Parkinson's disease or began experiencing movement symptoms, then they are diagnosed with Parkinson's disease dementia. If the dementia symptoms present first, along with movement symptoms, or within 1 year of movement symptoms, then they are diagnosed with dementia with Lewy bodies, okay? So there is this 1 year rule thing, okay? Now, Parkinson's disease dementia does need to be differentiated from other conditions as well, such as progressive supranuclear palsy and corticobasal syndrome, which are two rarer types of dementia that I still need to talk about and eventually will. But both of these conditions also cause Parkinsonism and cognitive impairment, so it can be a little tricky. But people with these conditions don't usually have a tremor. They tend to fall a lot more early on in the disease process. They don't respond well to medications such as levodopa, and they tend to progress far, far, far more rapidly, okay? Now, let's talk about some symptoms of Parkinson's disease dementia. So let me first say that these symptoms strongly overlap with that of dementia with Lewy bodies, which is why diagnosis is typically based off that 1 year rule, and also why you usually hear them talked about together as simply Lewy Body Dementia. Now, with that being said, some research has shown that people with dementia with Lewy bodies tend to have more pronounced cognitive fluctuations than people with Parkinson's disease dementia. People with dementia with Lewy bodies tend to have more prominent visuospatial deficits, which refers to having difficulty interpreting visual information and spatial relationships. And people with dementia with Lewy bodies tend to have more frequent and severe hallucinations and delusions. But overall, it's still pretty much the same symptoms, just a slight variance in degree and intensity, okay? So, people with Parkinson's disease dementia, or Lewy body dementia in general, will have impaired attention. So, they may get easily distracted and lose their train of thought, have slowness in thinking, impaired executive functions, especially when it comes to planning, decision making, multitasking, problem solving, and cognitive flexibility. They'll have visual spatial deficits, making it difficult to judge distances, gauge the depth of things such as stairs, curbs, or uneven surfaces, which obviously puts them at an increased risk for falls. They'll have difficulty orienting themselves in space or being able to find objects in a cluttered space. They'll have a harder time assembling things together or putting parts together like as you would with a puzzle, have difficulty recognizing faces or objects, and have poor eye-hand coordination, okay? They will also have trouble with their memory, but it's much milder, especially in the early stages, than what you would see with like Alzheimer's disease. And their impairment is not necessarily in storing new information in the beginning, but rather in retrieving the information that is stored. So the information may actually be in their brain, but they have trouble searching for, retrieving, and reconstructing it, okay? However, if they are provided with cues to help jog their memory and given extra time to recall the information, they may be able to pull it up. Now, procedural memory is often preserved in people with dementia, but with Lewy body types of dementia, especially Parkinson's disease dementia, procedural memory, which is a type of memory responsible for learning and performing motor tasks like brushing teeth, showering, using the bathroom, getting dressed, can be more impaired because Parkinson's disease primarily affects movement and motor control, right? So even if the memory was intact, the motor control may not be, and so we will see deficits in this area. Then with language, you may notice word finding difficulties and impaired comprehension of complex sentences. And then because of the movement impairments that affect muscles in the face, mouth, and throat, they may also speak slowly and softly, or they may speak really fast and stutter their words. It really depends on the person, and it could even depend on how advanced they are in their condition, okay? Now, real briefly, let's talk about some common behavioral symptoms that may or may not be present in someone with Parkinson's disease dementia. So we have apathy, which is a lack of motivation and indifference to things, personality and mood changes, including depression and anxiety, hallucinations, which impact about 30 to 60% of people with Parkinson's disease dementia, and are often visual in nature. So they may see people, animals, or objects that aren't there. They may experience delusions, which are usually paranoid in nature, but there are also other various types of delusions they may experience as well. And actually, since we're on this topic, I should go ahead and mention that we'll be hosting a webinar on hallucinations and delusions really soon. So if you don't want to miss that announcement, please be sure to subscribe to our newsletter at letsbamboo.com/newsletter, okay? And if you're listening to this episode after our webinar event, all of our webinar replays are available inside the treehouse at letsbamboo.com/treehouse. So no worries about that, okay? Now, moving along, you may also notice that your partner experiences excessive daytime sleepiness, where they feel drowsy throughout the day and struggle to stay awake. And as their disease progresses, they may also experience sleep attacks, where they fall asleep even during activities like eating or talking. People with Parkinson's disease dementia can also experience fragmented sleep at night, waking up frequently, but then having trouble falling back asleep. And then some may experience REM sleep behavior disorder, especially later in the disease process. And this is when people act out their dreams due to a lack of normal muscle paralysis during REM sleep. And this is a little bit different from dementia with Lewy bodies because REM sleep behavior disorder is like a hallmark feature for that type of Lewy body dementia and can be one of the earliest signs of dementia with Lewy bodies. Now, it can also happen early on in Parkinson's disease dementia too, or sometimes even before dementia symptoms ever begin, but it's not necessarily considered a hallmark sign, okay? And then the last set of symptoms that I want to be sure to mention for this episode is that people with any type of Lewy body dementia, including Parkinson's disease dementia, often have some level of autonomic dysfunction. So, this may look like orthostatic hypotension, where they experience a sudden drop in blood pressure when they go from sitting to standing or lying down to sitting up, causing them to feel dizzy, or even faint. Other issues can include constipation, urinary incontinence, difficulty regulating body temperature, irregular heart rates, and sexual dysfunction in some men. So, there's a variety of autonomic issues that can pop up, and they can vary in their intensity or severity, okay? Now, before we wrap this episode up, let's briefly touch on medications for people with Parkinson's disease dementia. So, I don't want to get too deep into this, but I do want to mention like four medications real quick. So, first, it's important to be aware that traditional antipsychotics like haloperidol, aka Haldol, should be avoided because people with any form of Lewy body dementia are at increased risk for adverse reactions, such as the worsening of Parkinson's symptoms, sedation, impaired swallowing, and neuroleptic malignant syndrome, which is a life-threatening condition characterized by fever, rigidity, and muscle breakdown following exposure to traditional antipsychotics. And this is important to be aware of because many people with Lewy body dementia experience hallucinations and delusions, like we talked about, and it puts them at a high risk for being put on antipsychotics, okay? Secondly, people with Parkinson's disease may be prescribed levodopa or some other dopaminergic medication to help manage their symptoms. However, these medications can also worsen visual hallucinations. So, for this reason, it is generally recommended to start a low dose and gradually increase it while monitoring for any symptoms. So, this is just another thing to be aware of and talk to the doctor about if necessary. Now, another medication beyond traditional antipsychotics that should be avoided is anticholinergic medications like Benadryl, Tylenol PM, Advil PM, and Dramamine. Many antipsychotics are considered anticholinergic as well, which is important to know. But avoiding anticholinergic medication actually goes for any person with any type of dementia because they can worsen cognition, increase confusion, and have a strong sedative effect, which increases the risk for falls. And then, especially for people with any type of Lewy body dementia, because it can worsen hallucinations and delusions, as well as worsen motor symptoms along with other things. So, yeah, it's best to avoid anticholinergic medications if possible. And then lastly, I want to mention Exelon, aka rivastigmine, which is the only cholinesterase inhibitor approved by the FDA to treat mild to moderate dementia associated with Parkinson's disease. It can help manage cognitive symptoms like memory loss, confusion, and difficulties with attention and reasoning, okay? But like I always say, all medications have side effects, and this one is no different. So as with any medication, it should be monitored for its side effects and effectiveness and adjusted accordingly, okay? So that is all for today's podcast episode. Of course, there is more we could talk about, but I think this episode is a pretty good length. Hopefully, I explained everything clearly and didn't confuse you. If you have any questions, comments, or future podcast requests, you can send us an email at podcast@whatthedementia.com or contact us through our website at letsbamboo.com. If you are listening to this on Spotify or YouTube, you also have the option to leave a comment. So thank you so much for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.